Serious patients must be given first due attention and should be monitored closely. Provide initial first aid treatment to the patients. Renders an efficient and humane care to the patients through patient-centered approach. The staff should notify the ward patient's arrival after completion of the admission paper. The admitting section does not offer consultation. For non-emergency patients, they are instructed to have their consultation at the OPD. Wounds within 24 hours treated in the ER are treated in the emergency room, and beyond 24 hours, like infected wounds, are treated at the OPD. Available emergency department written policies, procedures, practices, such as meetings, committees, activities, and process care discussion of manpower. It is expected that everyone be imbibed with the pleasantness and good human understanding in dealing with their co-employee, supervisors, and most of all, the patients. A smile instead of a frown must be heartily given. Bawal dito ang nakasimangot. So if you can see, we have this slogan, and I'm planning to paste this in the side, at the side of the emergency room. Have that enlarged and paste it on the side of the emergency room.
Some plywood.
Yes, sir.
Some plywood.
Of course, we have to take and record the patient's vital signs. Call the doctor immediately if the patient is acutely ill, or notify him as soon as the information has been obtained. As the patient comes in and seeks admission, the nurse takes the complaints from the patient himself or his companion, stating the duration and nature of illnesses. With regards to the medical legal cases, we still follow the NOI-TOI-POI, or the nature of illness, the nature of incident, the place of incident, and time of incident. Interpret the consent for operation and treatment. The consent for operation and or treatment, and let the patient sign. Let the parent sign if the patient is minor or less than 21 years of age. All patients admitted for surgical, gynecological, and other interventions should be requested for the consent for operation, properly signed and witnessed. The ER personnel escort the patients when transporting them to X-ray department and finally to the ward. Send the patient's belongings and valuables home. If possible, make an itemized list in duplicate and describe everything which belongs to him and which items are to be left. If the patient is too ill to assume responsibility, the relatives or friends accompanying him will check and sign the list. Obstetric patients in active labor or patients with cervical dilatation of 5 centimeters and above are sent directly to the delivery room. The admitting nurse or aide completes the admitting slip as soon as possible in the delivery room. For those with cervical dilatation of 4 centimeters and below, they will be directed to the OB ward or pay annex. Assessment of pregnant patients with communicable disease should be strengthened. If fully dilated, the labor room will be utilized and cord dressing will be done by midwife from the delivery room. All emergency cases must be examined thoroughly before orders given. The need for prophylaxis must not be overlooked. We mean giving of ATS for open wounds or operations. Verbal orders that are given upon the patient's arrival must be written on the chart after emergency measures are carried out. We should also note for the time when the orders are spoken down. Relatives of emergency cases not with their on admission must be immediately and properly notified through the MSSD. Notify the police headquarters in cases of vehicular accidents or any medical legal cases through the security guard on duty. In cases of physical and sexual abuse of female and children, this
we have made is not yet complete. Since this is the first time we will make this compilation, whatever you may add will be greatly appreciated. officers, the residents, are required to their duty rounds on
Hindi ka na
all
lang dun.
patients, including
Para matuto.
co-managed patients
Para
from
matuto,
other
mamaya babalikan
departments.
mo. Ano na lang.
Are required to do their daily rounds on all patients. Number 2, medical specialists, consultants are expected with the daily rounds with the medical officers or residents. All admitted patients should have their complete history and initial assessment upon admission. If everybody with summary should be accomplished and discharged in the discharge of the patient. Prescription should be purchased outside the hospital. Number 7 is not yet implemented. All laboratory ancillary procedures available can be sent out to other laboratories or hospitals with proper coordinated legal document. And no part of the patient's hospital record shall be reproduced or the resident on duty to see that patient. The same policies are applied to patients being referred for CP clearance or laboratory ancillary procedure requests or results. All results should be signed by the requesting physician. All requests for stat procedure should be properly facilitated by the requesting physician. As a rule, a stat procedure should be accomplished within an hour. Courtesy should be given by both the facilitating and the accepting departments, wherein acceptance or refusal of the procedure should be discussed by concerned doctors, not by a nurse or aide to a doctor or a doctor to a technician. Results of routine procedures should be out within 24 hours. That's all.
From 1 p.m. to 5 p.m. All residents are expected to be at the OPD not later than 9 a.m. and 1 p.m. These are physicians who are having their rounds should endorse their patient or do their rounds earlier or just to be at the OPD 9 a.m. There should be at least one resident on duty at the OPD in every department. In cases where no resident is available in the department chairman and the OPD head should be informed for proper action. In cases where consultants or active voluntary are assigned to see OPD patients, their absence or unavailability should be properly coordinated with the OPD head or OPD nursing supervisor for proper scheduling and instructions of the patients. Kasi in cases na consultants or voluntary were scheduled for that day and the consultant was not able to come, the patient are waiting and the OPD are not properly informed. So the patient nagagalit, include the physicians. 24-hour duty physician residents are not allowed to be the residents on duty at the OPD. Minor operations should be done at the minor OR following the OR schedule. Dressing wound, INT, removal of stitches. Number 9. Patient's record should always be completed prior to patient's discharge from the OPD. This should include the general data, medical history, physical examination, diagnosis, and plan. The same record shall always be used in patient's follow-up. Number 10. Patient's